think you know what causes ringing in your ears? Chances are you have heard some myths about tinnitus. Today we are busting top 9 misunderstandings about tinnitus because it is a annoying disease. Research still is not conclusive. What are the reasons we develop tinnitus? It robs us physically, emotionally, psychologically, and socially. It has a lot of consequences and it drains us. In this video, my goal is to bust 9 most prevalent myths which we have so that you understand the facts properly and you should be able to navigate this disease in a way that you are comfortable with yourself. My name is Dr. Kulmeet Kundlas. I've been a primary care physician for 27 years and I have a special interest in tinnitus. Is tinnitus permanent? We do not know what causes tinnitus other than few circumstances, and nobody can predict its course for future. We do not know whether it's permanent or transient. It could take any shape, so do not make any opinions. I've seen when people get acutely sick with the tinnitus, and once they start conjuring this life where they believe is permanent, they become deeply depressed and anxious. Does tinnitus happen only in older people? Biggest myth. Tinnitus can affect anybody. Nobody is immune. Make sure that if you have been in a situation where you have been constantly exposed to loud sounds, especially our veterans, construction workers, and concert professionals, they are at high risk to develop tinnitus at any age. Tinnitus is just in your brain. It is nowhere. Tinnitus is a phantom sound which is generated possibly from 4 sources. We do not know which one is contributing in you. But in research, we have found the hair cells in your inner ear, your auditory cortex, your other cortical areas, and your emotion centers, and some surrounding structure in your neck and vascular system can give you tinnitus. Tinnitus does not kill anybody, it annoys the heck out of you. All sounds are similar. Tinnitus can present in any weird sound: buzzing, hissing, screeching, screaming. Nobody has a one set pattern, and we cannot predict what kind of sound you will develop. If you have tinnitus, you should avoid all sounds. This is, I think, is the biggest fallacy. We know for a fact once you develop tinnitus, either you are partially deaf or completely deaf, or certain frequency your ear cannot discriminate. Once you are alive and well in this world and you have input from different sources, your tinnitus will be suppressed. As you have recalled, tinnitus gets worse at night because the sound input from other places get. Myth that tinnitus always progressive and get worse. False. Tinnitus has a variable course. Sometimes it gets worse, sometimes it gets better. And one biggest of all is it's a rare disease. Tinnitus is very common. It affects on yearly basis 7 to 10% of population, and out of that 1 to 3% have a disabling tinnitus. I hope I have provided you with clinical evidence-based information about tinnitus myths. Please like, share, and subscribe to our channel, and I will see you in next video. I have put in the link the playlist for tinnitus. Thank you very much.